Whenever you're thinking about closing the needle body or with the handle, always think to yourself, is my catheter, my anchor exchange catheter, back within the scope channel? If your anchor exchange catheter is visible, you will either bend the anchor or you will bend the needle body. So anytime before you close, take a look and make sure that you've pulled back that anchor exchange catheter. And then suture slack, we talked about probably the two best ways are moving the anchor exchange catheter in and out of the scope channel a few times. So you always want to do that about 4 or 5 times when you're just initially setting up the device. And then you want to do it a couple times so that you have enough slack to be able to reload an anchor when you're doing your suturing. And the other mechanism that you can use is to pull the scope back slightly, which will also give you some slack. Prior to cinching, so when you're doing your cinching, your left hand, you're going to be pulling back on the suture to tighten everything down. Your right hand is going to be pushing out the cinch catheter. You want to make sure before you cinch that you're able to see the rings on the cinch catheter so that you're not going to be deploying the cinch in the scope channel, for example. And then remember, cinches can be disposed of after use, but do not throw away the anchor exchange catheter until you're done with the suturing. We've had that happen, and then you have to open up a whole other system.